First of all, I'd like to thank Luminary Labs and Sanofi for this wonderful opportunity. It really is a privilege and an honor to be here tonight. I'm here with our co-founder, Gopi Mami Deputy. I'm David Parpart, CEO of Socially Relevant Technology. And our team is going to save 500,000 lives this decade. I'm here to introduce iRetainRx technology for adherence to help you take your medications appropriately and help pharmacists prevent the pitfalls of medication non-adherence for all patients and increase refill rates. Have you ever gone to the doctor and pharmacy and later you get home and someone asks you, what did they say? And you honestly don't know? This causes people to take their medications inappropriately, which causes 125,000 unnecessary deaths and $290 billion in additional costs. Now, people with diabetes are challenged by their regimens. We look at the numbers, and less than 2/3 of people with diabetes are adhering to the 4 interventions. Now, for pharmacists and drug manufacturers, that means lower refill rates. But for you and I as American taxpayers, that means $37 billion in additional cost. And that leads then to huge social costs. So there's something missing. And iRetainRx is here to address this crisis now. iRetainRx is like a good friend to aid patients who need more than just a doctor's prescription. It's a mobile companion to aid patients through their treatment plan. Now, iRetainRx is more than just a mobile app. iRetainRx is a platform which enables healthcare organizations to plug in and to deliver effective, patient-centered medication adherence outreach. For you, the patient, what we're doing is we're helping you take your medications appropriately. And we're opening up communication channels between you, the patient, your pharmacist, and your caregivers. And that may be your doctors, but it may also be the people who just identify as good friends, or mom, or a good son. When a patient goes to the pharmacy to pick up their medications, the moment that they hand the medication to the pharmacist hands the medication, this is called the over 90 consult. And so what we are doing is we are helping pharmacists to prevent the pitfalls of medication non-adherence for all patients by optimizing the over 90 consult and making it available to you, the patient, and available to your caregivers, or allowing you to share that with your caregivers when you get home. Now, easy enough, one of the cool things we're doing is smart technology, right? It'd be easy to distribute NFC tags, little stickers that we could take off and put onto a bottle at this touch point. Additionally, we can take a little wallet card. With NFC technology, that can go into the wallet and provide a personal medication record, which can grow and evolve with doctor visits, while at home as you're using the application, and so forth. And this is vital in an emergency when an EMT comes. Now for patients, we're providing free to the marketplace, and for pharmacists, we're delivering this over 90 in conjunction with the American Pharmacists Association and California Pharmacists Association, free to independent pharmacists. There's 24,000 of those out there in the marketplace. For patients, we're delivering free to patients tools that help you take your medications appropriately. And specifically, the interface for diabetes is awesome, right? NFC is a great touch point, so you could access a mobile app just as normal, but NFC allows us to simply touch and bring up an action. I can touch my pill bottle, and it can tell me exactly what I need to do next. And for patients, what we're doing with this platform is simplifying, informing, motivating, and rewarding them as they go through their treatment plan. Now, specifically for patients with diabetes, we talk about 4 adherence pieces or 4 intervention pieces. We've got our medications, which are important. We also have nutrition. We've got activity. And so what we're doing is making it easy to monitor and track those things too, right? With a simple touch, you can bring up the app and finally get to know your numbers. Now, we're building our core competencies enable us to do multimodal distribution so we can do multiple touch points. We also have core competencies in big data and optimization and personalization. So we're creating a retention risk index to predict non-adherence. Then what we're doing is delivering that index back to providers, pharmacists or prescribers, and allowing us to intervene early for people who are having adherence challenges. And one of the ways we're doing that is through medication therapy management with the pharmacist, either face-to-face or remote. Essentially what we're doing for patients is really trying to take this big idea of a treatment plan, and for a nephrology patient, for example, or for a dialysis patient, they're on 8 medications, right? So we're trying to take this big treatment plan and shrink it down into something that's very simple and actionable. Would you go ahead and start the video for us so we can see how Courtney might use this?
My name is Courtney. I'm diagnosed with diabetes. This means I'm at the doctor's a lot. I need all the help I can get. My mom is great. She helps me out by coming to all my appointments. Mom gets a prescription at the pharmacy and also gets counseling with the pharmacist and help from iRetainRx. They provide meds with the containers that have smart stickers. I could touch the sticker with my phone, and my phone's app tells me what to do. In the past, I was confused a lot about my meds and what the doctors told me. Mom was always worrying about me. I didn't know what to do about my numbers and what they meant. But now, with iRetainRx and my phone app, I know what to do. My mom knows how to help me with my diabetes. Now I could do the things I want to do. iRetainRx is a friend who is absolutely necessary for me to survive. And best of all, my mom doesn't worry so much.
And again, this reminds us why we've got so many great people here in this room tonight. It's really to affect and improve the lives of people who are living and dying with diabetes. Question always comes up for us about these smart stickers. And NFC is a technology that's now in most new mobile devices. But it's not the only touch point. But the NFC touch point is a valuable touch point because it's very user-friendly and it's low cost. These devices, these cards could be distributed at less than $1.50 per unit and provide a smart personal medication record that every person could have in their wallet, which would help with drug reconciliation as well as in the case of an emergency. Our team includes scientists, or doctorates in medical science, computer science, predictive algorithms and mathematics and optimization. We also have leaders in behavioral economics as well as consumer engagement strategies and social inclusion strategies on our team. We've got a world-class group of advisors working with us, including state and national associations for pharmacists. And again, essentially what we're doing here is we are helping pharmacists, the independent guys who can't afford a lot of great technology. We're helping them to optimize the over 90 consultation when the patient picks up the medication for all patients for free. We're then allowing patients and caregivers to access that information when they get home and to be able to engage caregivers to support patients. With patients, we're breaking it down into the next right thing and rewarding patients as they go through their treatment plan. We're tracking all of this, we're identifying people who are having trouble, and we let the providers know that they're having trouble so we can intervene early. Now, medication therapy management, many of you may not know this, but in the future, doctors of pharmacy are going to have to start acting more like doctors. They're going to be the co-pilots working with the prescriber team in order to prevent patients from having adverse effects and engaging patients in their treatment. Now, medication therapy management is a huge opportunity for pharmacists, for patients, and for payers. What we do for the independents, again, is give them all of this technology for free. If they want to do medication therapy management, we provide an end-to-end service, including billing for that. Now, MTM is a huge opportunity for these independent guys, so what we're doing is taking 5% of gross revenues. So if they can make $300,000 on this, we take $15,000 or $15 million per 1,000 pharmacies. It's estimated that 12 million Medicare recipients right now are eligible for medication therapy management with their pharmacists, and we're seeing private payers looking to get into the medication therapy management payer pool too. Again, we help pharmacists, the independents in the marketplace, by providing something free of charge. Now, other health organizations can tap in and plug into this. We streamlined the over 90 process for all pharmacists and opened up a new revenue channel while helping patients take their medications appropriately. We are seeking seed funding of $500,000 to launch the over 90 and free services for patients. And we are going to be launching a pilot in Texas and California in conjunction with Dallas Nephrology and the California Pharmacy Association. Bottom line here, iRetainRx is going to save lives, it's going to cut healthcare costs, and it's going to provide revenue opportunities for pharmacists and investors. Thank you very much.